bad breath, and sore teeth. If you had to guess, what would you say causes these symptoms? Would you believe it could be your sinuses? Many people who have sinus problems don't seek treatment because they don't realize what's causing their symptoms. And this is something doctors hope to change.
Endless sneezing, splitting headaches. If you've ever suffered from sinus problems, you know they can really get in the way.
My life completely stopped.
John Sokolich suffered for 15 years until it finally got so bad he isolated himself inside his own house.
I had a hard time sleeping, hard time breathing. I would always have headaches, congestion, runny nose, and it just completely stopped me from doing the things that I love to do.
Like fishing. But the great outdoors came at too great a cost for John, exacerbating his allergies and making his sinus symptoms unbearable.
Just got to this pattern of I just didn't want to go outside. I didn't want to feel like that every day.
John did make one crucial trip to see Dr. Gordon Epstein, an ear, nose, and throat specialist at Sutter Health's Palo Alto Medical Foundation. And this expert says if over-the-counter medications don't relieve symptoms within 2 to 3 weeks, it's time to get help.
The treatments and techniques we have for managing sinusitis are so much better now than they were 5 or 10 years ago that it's very possible to help many people who could not have been helped before.
One problem is many people don't recognize the symptoms of sinusitis, which can range from headaches and bad breath to earaches and even a loss of the ability to taste and smell. And because people aren't connecting the dots, many figure they just have to live with the symptoms.
This is very, very bad. It's coming in my forehead.
I get all stuffed up and I'm on drugs basically all through the spring.
37 million Americans suffer through at least one episode of sinusitis each year.
I mostly get sinus headaches, swelling, postnasal drip.
The sinuses are made up of 4 main air pockets inside the front of the skull, and each sinus cavity is made up of tiny passageways. During a sinus infection, the membranes inside those air pockets swell up, which can make it very hard to breathe.
Here's the brain and here's the eye socket, and you can see the sinuses, which are filled with air, show up as being black.
Black areas indicate all's clear, but in John's CAT scan,
And it shows how his airway was almost totally blocked by a combination of thickened lining filling the sinus passages, swelling the lining of the nasal cavity. They can see what is actually causing this thing that's been tormenting them for so long.
My sinuses were closed. They were basically blocked. And what was happening was all the disease behind that was causing me to be sick all the time.
most patients respond to prescription drug therapies, tailor-made combinations of antibiotics and steroids designed to kill the infection, relieve the pressure, and take that swelling back down. But John turned out to be one of the 1 in 10 patients with sinusitis who need surgery to open the sinus cavities back up.
From the exams we do before the surgery in the office and with a CAT scan, we can then address the specific problem, remove that obstruction, and open up their sinuses so they drain better.
John's 4-hour procedure yielded immediate results.
Good boy. I noticed it the day I got the surgery done. When I was in the recovery room, I could feel the air going through both my nostrils, and it was such a sense of relief.
3 months post-op, and John is gearing up to go fishing. His sinus symptoms are gone.
The surgery has definitely changed my life. I don't get sick as often. I can go outside whenever I want, and I didn't have that freedom before. There's definitely a hope.
If your sinus problems are mild, there are some home remedies you can try. Apply moist heat with a hot towel to your face several times a day. Consider getting a humidifier and, of course, drink lots of water. If you continue to have symptoms, talk to your doctor.